All right, so we're moving on to the next aspect, and this aspect is cervical examination. All right, cervical examination in gynecology. Okay. Cervical examination in gynecology. So if I'm actually trying to look at the cervix of a woman, the cervix being down here, okay, what methods am I using to look at the cervix of a woman, and what is the reason why I'm trying to look at the cervix of a woman? Do you understand? Those are the questions that cervical examination actually answers. So it's actually an important part of gynecological physical examination. So it offers direct insight into health of the cervix and the surrounding structures. Okay, so why cervical examination matters? It can help you to dictate infections in the cervix. It can help you to screen if there's cancers coming up. It can help you to access for any anatomical abnormalities. Okay, it can also help you to evaluate cervical consistency. So cervical examination step by step is this. Of course, for you to be able to look as down as this, or for you to be able to put instrument properly, you need an instrument to actually keep it wide enough. That's what we call a speculum. Okay, so explain the procedure. First of all, you explain it to the patient and they have to actually give permission. Ensure privacy. Use a chaperone if needed. Position the patient in lithotomy position. This down one, the legs of the patient is up like this, up like this, while the patient, the body is like that. Do you understand? Then use a warm speculum and water-based lubricant. So you have to lubricate. You don't just start going into a dry patient like that. So speculum examination: inspect vulva and vaginal walls for lesions or discharge. You observe for color, changes, external OS, to see if there's discharge, to see if there's lesions, to see if there's bleeding or friability. So you can now go for a pap smear. This you trying to take samples for a pap smear, human papillomavirus testings, and wet mounts or swabs. Okay, so that's it for cervical examination in gynecology.